Imagine this. You wake up, middle of the night, and boom. One of your joints feels like it's literally on fire. We're not talking about just a little ache. This is intense, throbbing agony. Makes even a bedsheet feel like torture. For ages, there was gout, the disease of kings. But here's the thing, the really crucial truth we need to dig into today. It is absolutely not just for kings anymore. Not at all. This condition is quietly hitting millions of older adults, really impacting their mobility, their independence. So, okay, let's unpack this. What is really going on here?
That's a vital question. And what we're going to explore in this deep dive is that gout, well, it's way more than just some annoying pain. It's actually a serious inflammatory disease. If you don't get a handle on it, it can permanently wreck your joints. And it doesn't stop there. It can impact your whole health. And listen, if you're over 60, you're especially vulnerable. It can kind of creep up on you. We'll get into the crystal truth behind that awful pain, the systemic dangers, things beyond the joints that most people don't realize, and importantly, how you can actually fight back naturally. Take control.
Yeah, and here's where it gets really interesting, or maybe misleading. So many people still think, oh, gout, that's just too much steak, too much wine.
Yeah.
This is Victorian-era thinking, honestly.
Yeah.
And holding on to that idea really harms seniors today because it can stop them getting the right diagnosis. The real reason, the thing causing that just excruciating pain people talk about, well, it's microscopic. It's these needle-sharp uric acid crystals building up right inside your joints. Like, imagine tiny little shards of glass just scraping the lining every time you move.
Exactly, and this is why understanding it is so critical for folks in their golden years. See, your body, it actually makes about 80% of its own uric acid, just naturally, internally. Food only contributes maybe 20%. So the main issue for older adults often isn't just diet. It's more about the body's changing ability to get rid of that uric acid efficiently, and that's why age makes you a target. After 60, we typically see three key things happening. First, your kidneys. They're the main filters, right? They pull uric acid out of your blood. But kidney efficiency tends to dip a bit as we age, maybe 10% per decade after 40, something like that. Less filtering means, well, more chance for crystals to form. Second, medications. Some really common ones can unfortunately raise uric acid levels. Things like low-dose aspirin for heart health or certain blood pressure meds like ACE inhibitors. And third, what I sometimes call the comorbidity storm. Basically having multiple health conditions together, high blood pressure, diabetes, heart issues, kidney problems, they all kind of gang up and make you much more likely to develop gout. It's like dominoes falling.
Wow. And there's something really important for women listening, right? This gender flip idea. Because traditionally, you hear about men getting gout more often.
That's right. Historically, men had higher rates, partly because testosterone can actually make it a bit harder for the body to eliminate uric acid. But after menopause, a woman's risk can shoot up dramatically. Why? Well, estrogen actually helps the kidneys get rid of uric acid. So when estrogen levels drop after menopause, uric acid can climb into that danger zone. So the crucial message here is, if you're a postmenopausal woman and you get sudden really bad joint pain, please don't just brush it off as, oh, it's just arthritis. Insist it gets checked out properly. It could easily be gout.
That's such critical information. Okay, so beyond those main risk factors, are there other triggers? Maybe ones people don't think about as much, especially for seniors?
Absolutely. There are definitely some hidden triggers that hit older adults harder. Dehydration is a huge one. As we get older, our sense of thirst can kind of fade, and when your blood gets more concentrated, it's easier for those crystals to form. Quick tip, just check your urine color, aim for pale yellow. Another trigger, maybe surprising, is stress from surgery, or even just being really sick. That physical trauma can cause tissues to break down, flooding your system with purines, and paradoxically, even losing weight too quickly can trigger an attack. Muscle breakdown releases purines too. And finally, don't underestimate sleep. Poor sleep messes with the hormones that regulate how your body handles uric acid.
Okay, so with all that said, let's just do a quick Purine reality check, because people do hear about the food connection.
Right. And it's not that food doesn't matter at all. Certain foods are high in purines, but honestly, obsessing only about your diet while ignoring kidney function, medications, hydration, all that stuff we just talked about, that's kind of backwards thinking. It's about moderation, not total panic. The main things to be mindful of, to maybe cut back on: red meat, especially organ meats like liver, certain seafood, shellfish, anchovies, sardines are often mentioned. Beer is generally seen as the worst alcohol choice for gout sufferers. And maybe surprisingly, high fructose corn syrup, which is in a lot of processed foods and drinks.
Interesting. It's a much bigger picture than just the dinner plate.
It really is. And it's fascinating to look at this from an Eastern medicine viewpoint, too. Traditional Chinese medicine, for instance, might see gout as the body just struggling to transform and eliminate metabolic waste properly. Signs your elimination system might need some support, maybe feeling really sluggish after eating, bloating, digestive issues, always craving cold drinks, or feeling extra irritable during a flare-up. And here's probably the most critical point, the systemic danger we hinted at earlier. Gout isn't just joint pain. It's not isolated. The same inflammation causing agony in your toe or knee is also quietly attacking your cardiovascular system. People with gout have significantly higher rates of heart attacks, strokes, kidney disease. It's serious stuff. Think of your joints as the canary in the coal mine. They're yelling a warning about inflammation throughout your body. But the flip side, the empowering part, is that understanding these deeper roots gives you the power to address the underlying issues, not just mask the symptoms.
That connection is huge. Wow. Okay, so let's talk about recognizing an attack. I remember hearing about someone waking up just terrified by the sudden pain.
Yes, that suddenness is key. Gout attacks often follow what we call a lightning strike pattern. It's classic. It goes from maybe zero pain or just a twinge to absolutely excruciating pain incredibly fast, usually within, say, 4 to 12 hours, and often overnight. People use strong words like nails being driven into the joint, and the tenderness is extreme, just the weight of a sheet, unbearable. The absolute worst of the pain usually peaks in the first 24 to 48 hours.
And what does it look like? Are there visual clues?
Oh, absolutely. Some very clear visual red flags you really can't ignore. The joint itself will often look bright red, maybe even purplish. The skin over it can get shiny, kind of stretched looking. And if you were to gently touch near it, you'd feel heat. It radiates warmth. Honestly, if a joint looks that angry and inflamed, that's your cue. Get medical help, quickly. And while everyone talks about the big toe, and about half of first attacks happen there, it's really important for seniors to know gout often hits other target zones. We see it a lot in ankles, especially in women. Knees, too, and that often gets confused with an arthritis flare-up. Fingers, particularly common in post-menopausal women. And elbows, often seen in men who've had gout for a while.
Okay, so knowing the signs is step one. But what happens next? What's the progression? You mentioned phases earlier.
Right, understanding the journey of the disease is key. There are basically 4 phases every older adult should understand. Phase 1 is the silent buildup. The medical term is asymptomatic hyperuricemia. Your uric acid levels are high, usually over 6.8 milli-GDL, but, and this is the tricky part, you feel completely fine. 0 symptoms. This phase can go on for years, and the insight here, this is your absolute golden window for prevention before any pain starts.
That silence is deceptive, isn't it?
Totally deceptive. Then comes phase 2, attack mode,
Yeah.
acute gout. These are those sudden, severe attacks we just described. They might last 5 to 10 days if you don't treat them, but between attacks, you often feel completely normal again. This creates a really dangerous false sense of security, like, oh, it's gone.
But it's not really gone.
Exactly. Which brings us to phase 3, the quiet storm, or intercritical gout. This is the time between attacks. You might feel fine, but underneath the surface, those uric acid crystals are still forming, still depositing in your joints, silently. And over time, the attacks usually get more frequent, maybe start hitting more than one joint. And finally, phase 4 is advanced chronic gout. This is where you might see those chalky lumps under the skin. They're called tophi. You can get prominent joint damage, maybe continuous pain, and often kidney problems too. It's the long-term consequence of not managing it.
And you mentioned earlier that gout can look a bit different in older adults.
Yes, that's a crucial point. It doesn't always read the textbook. There are senior-specific warning signs. For example, older folks might get attacks in several joints right from the get-go, unlike younger people who usually start with just one. Sometimes the pain itself isn't quite as dramatic. Age can kind of blunt pain perception sometimes, which sounds good, but it's dangerous because it can delay diagnosis. Attacks might also last longer, maybe weeks instead of just days. And we see hand involvement much more often, especially in elderly women.
So it can be missed easily.
Very easily. There's also what we call the mimicry problem. Gout in seniors can look like other things. It can mimic cellulitis, making the joint red and hot like an infection, or it can seem like just a bad arthritis flare, or even pseudogout that involves different crystals but feels similar. So yeah, diagnosis needs care, and just quickly, there are definitely dangerous symptoms needing emergency care. Don't wait. If you have joint pain, plus a fever over 101 Fahrenheit, or red streaks coming from the joint, any sign of pus or really extreme heat, if you suddenly can't put weight on the limb, or if you have nausea and vomiting along with the joint pain, get to an ER or call for help immediately.
That's vital to know. You also mentioned Eastern medicine again.
Yeah, briefly. From a traditional Chinese medicine view, they might see different patterns, like a damp heat type, red, swollen joints, feels better with cold, or wind-cold pain that moves around, worse in bad weather, or maybe a kidney yang deficiency pattern, in chronic cases, less intense attacks, feeling cold. But the main takeaway is always remembering gout affects your whole body. It's not just the joint in isolation. You might feel wiped out, fatigued during an attack, run a low-grade fever, sleep gets disrupted, your mood can tank, even digestive upset can happen.
And that feeling of relief after an attack, that's the trap, isn't it?
It's the deception of recovery. It's such a cruel trick gout plays. You feel totally normal, so it's easy to think, phew, dodged a bullet, or it was a one-off. But you have to remember, the crystals are still building up silently during those pain-free times, and every single attack makes the next one more likely, and probably worse.
You mentioned women getting it in their hands more after menopause. Are there other key gender differences?
Generally, yes. The classic presentation is more common in men, starting in the big toe, usually one joint at a time, and often starting at a younger age than women. Women, as we said, tend to see it more post-menopause, often in hands and fingers, and sometimes involving multiple joints earlier on. We also watch for specific red flag combinations in seniors, things like having joint pain and a history of kidney stones, or getting gout attacks while taking certain blood pressure meds, or having pain in multiple joints if you also have diabetes, or a history of gout attacks if you also have heart disease. These connections are really important clues.
So the bottom line is, act fast.
Yes, that's the urgency factor. Recognizing it early and managing it consistently. That's how you prevent the really bad stuff. Joint destruction, kidney damage, those serious heart complications, and ending up chronically disabled. It's all about timely action.
It really paints a picture. I remember a patient, let's call him Mr. Chen. He came in using a walker, his hands. They were visibly gnarled, these chalky white lumps under the skin. He told me, voice really quiet, I ignored my gout for 15 years, just pushed through the pain, now I can barely dress myself. It was heartbreaking and so preventable. Untreated gout, it seems to follow this predictable downward path, doesn't it? This joint destruction timeline.
Sadly, yes. It's often quite predictable if left unchecked. You know, maybe the first year or two you have occasional attacks, but you recover fully in between. Seems okay. But then maybe years 3 to 5, the attacks get more frequent. They start hitting multiple joints. By years 5 to 10, often you're dealing with chronic pain, stiffness, even when you're not having a full-blown attack. And if it goes on beyond 10 years without proper management, that's when you can see permanent joint deformity, real disability. The analogy I sometimes use is like repeated earthquakes hitting a building. Each attack weakens the joint's foundation, the cartilage, a little bit more, and that damage adds up. It's irreversible.
And those chalky lumps Mr. Chen had.
Yeah.
Those are the tophi you mentioned.
Exactly. Tophi. The visible catastrophe. That's what they represent. They're literally deposits of uric acid crystals that build up under the skin over time. You can see them in common spots. The ears actually are a classic place. Fingers, which makes gripping things really hard. Elbows. Feet making walking agony, even in the Achilles tendons, which carries a risk of rupture. Seeing tophi? That's a huge red flag. It tells you uric acid levels have been dangerously high for years. It means significant joint damage has already happened. It strongly suggests the kidneys are involved, and it signals a much, much higher risk for heart problems. They're a serious warning sign.
Wow. And the kidneys themselves are at risk too, right? You said double jeopardy.
Yes, the kidney crisis. Gout hits the kidneys in 2 main ways. First, up to 20%, 1 in 5 gout patients eventually develop painful kidney stones made of uric acid. Second, high uric acid itself can damage kidney tissue over time, contributing to or worsening chronic kidney disease. And this is especially dangerous for older adults because, as we discussed, kidney function often declines naturally with age anyway. Plus, seniors are often on multiple medications, some of which can stress the kidneys, and they're more prone to dehydration. It's a bad combination.
Okay, and then there's the heart connection. You mentioned some stats earlier. 60% higher risk of heart attack. That's staggering.
It is staggering. The heart-gout connection is one of the most crucial and often overlooked aspects. Research clearly shows gout significantly increases your risk 60% higher for heart attacks, about 40% higher for strokes. Also higher risks for heart failure and atrial fibrillation, that irregular heartbeat.
The inflammation isn't staying politely in your joint, it's circulating, it's damaging blood vessels, it's impacting your heart. So I'll say it again, that pain in your joint, it's a warning sign for your heart health too. Don't ignore it.
It really is all connected. And it seems gout often comes with other issues.
It rarely travels alone, especially in older adults. It's part of this broader metabolic web. It's tightly linked with diabetes. High uric acid can actually interfere with how your body uses insulin. It's linked with high blood pressure, and some gout meds can even make blood pressure worse, so management needs care. Obesity is a big factor. It increases uric acid production and makes it harder for your kidneys to get rid of it. And even sleep apnea. When you stop breathing briefly at night, oxygen levels drop, and that can actually trigger your body to produce more uric acid. It's all intertwined.
And all of this can lead to, well, a loss of independence, right?
That's a disability cascade. And honestly, it's maybe the most tragic part for many seniors. Untreated gout can literally accelerate the aging process. Think about the spiral. The joint pain makes you less active. Being less active makes your muscles weaker. Weaker muscles mean a higher risk of falling. Falls often lead to fractures, hospital stays, and hospitalizations, unfortunately, are known risk factors for faster cognitive decline in older adults. It's a devastating chain reaction.
It's not just physical either. Is it the constant pain, the fear?
Absolutely not. The psychological devastation is profound. Chronic, unpredictable pain takes a huge toll. It leads to social isolation. People become afraid to go out, afraid of having an attack in public. It causes depression, anxiety about when the next attack will hit. Sleep is constantly disrupted. People lose their sense of self when they can no longer do the activities they loved. I've seen vibrant seniors become withdrawn, almost hermits, because of uncontrolled gout. It steals their quality of life.
And managing all this alongside other conditions must be complicated, especially with medications.
Extremely complicated. That's the medication maze. Older adults are often on multiple prescriptions for various conditions. Adding gout meds into the mix requires real care. For example, mixing certain blood thinners with some gout drugs. Big increase in bleeding risk. Combining certain kidney meds with diuretics often used for gout can harm the kidneys further. Taking common anti-inflammatories for gout pain alongside certain heart meds can cause serious heart issues. It needs careful coordination with a doctor who sees the whole picture.
So the consequences of not managing it, they're severe.
They are. The cost of neglect is incredibly high. We're talking about needing joint replacement surgery down the line, maybe kidney dialysis if the damage is bad enough, major cardiovascular interventions, ongoing chronic pain management, which often involves strong medications with their own side effects, loss of independence, and ultimately for some, needing nursing home care much earlier than they otherwise would have.
And does this destruction happen faster in older people?
Generally, yes. The speed of destruction can accelerate in seniors. Why? Well, cartilage, the cushion in your joints, doesn't regenerate as well when you're older. If you already have some arthritis, those joints are more vulnerable to begin with. And when pain reduces your activity, joints stiffen up much faster.
Is there a point where it's just too late?
There can be a point of no return, sadly. Once joints are severely damaged, eroded by the crystals, and large tophi have formed and maybe even damaged surrounding tissues, that damage is largely irreversible. Surgery can sometimes remove tophi or replace a joint, but it's major surgery with its own risks. Prevention, catching it early, managing it consistently, that is infinitely better than trying to fix severe damage later.
So why do so many people seem to suffer silently? It sounds like a hidden epidemic.
It really feels like that sometimes. There are a few reasons. Many seniors just assume joint pain is a normal part of getting older. They just try to live with it. Sometimes doctors might dismiss symptoms too quickly as just arthritis, especially if it's not in the big toe. People might be afraid of medication side effects, which is understandable. And sadly, there can still be some embarrassment, that old stigma of gout being a lifestyle disease caused by overindulgence, which we know isn't the whole story, especially for seniors.
So this really is an urgent wake-up call.
It absolutely is. You cannot just tough out gout. It's a progressive disease. Every single day you delay getting it properly managed, those crystals are quietly forming, depositing, damaging. But, and this is the crucial takeaway, the empowering truth, every single one of these devastating complications we've just outlined, they are, by and large, preventable. You genuinely have more power, more control over gout than you do over almost any other common age-related condition. You can fight back.
That's such a hopeful and important message. It reminds me of Mrs. Park. Just 3 years back, she was having these awful gout attacks almost every month. Scared to leave the house last week. She sent me photos from a hiking trip in the mountains. She's been completely gout-free for 2 solid years. Her secret wasn't some miracle cure. It was understanding, finally, that gout is absolutely controllable if you approach it the right way. It really drives home that empowering reality. Unlike so many things that happen as we age, gout responds beautifully to natural interventions and lifestyle adjustments. You don't just have to accept it, you can reclaim your life.
Exactly. So let's talk about that. Let's talk about your natural defense arsenal. What can you actually do? First off, simplest thing, the hydration revolution. Seriously, drinking enough water is your absolute #1 defense. It helps your kidneys flush out that uric acid. Aim for pale yellow urine throughout the day. That's your target. And a nice little tip. Start your day with warm water with a squeeze of fresh lemon. It's thought to gently support kidney function.
Simple but effective.
Next up, tart cherry power. You might have heard about this one. Tart cherries, whether you eat them, drink the unsweetened juice, or take an extract. They are like nature's anti-inflammatory medicine. Studies show they can help lower uric acid levels and reduce the frequency of attacks. These ruby gems are powerful. Then there's movement medicine. Now, obviously, not during an acute attack, rest is key then, but gentle, regular activity between attacks, crucial for prevention. Even just 10-15 minutes of walking each day improves circulation, helps manage weight, supports overall joint health. It all helps keep uric acid in check.
And diet. We say it's not the only factor, but it plays a role. What kind of eating helps?
Right. It's about building an anti-inflammatory kitchen. Shifting focus towards foods that actively calm inflammation in your body. Think lots of leafy greens. Yes, some have purines, but their overall effect, helping your body eliminate uric acid and fight inflammation, is beneficial. Don't avoid them. Omega-3 rich fish like salmon or mackerel. Turmeric and ginger, fantastic natural inflammation fighters you can add to cooking. And focusing on complex carbohydrates, whole grains, vegetables, fruits, rather than refined sugars and white flour, it helps keep your system balanced.
And bringing back that Eastern medicine perspective, are there things from that angle?
Definitely. Tying into that idea of supporting elimination Eastern medicine wisdom suggests simple things, like choosing warm beverages over ice-cold ones most of the time, as cold is thought to constrict flow. Using warming spices like ginger, cinnamon, cardamom in your food. Also focusing on deep breathing. Simple breathing exercises can actually help lower stress hormones, which reduces inflammation. And prioritizing good sleep, that's huge for hormone regulation, including uric acid metabolism.
The stress link seems really important too.
It's massive. The stress connection is undeniable. Chronic stress keeps your body in a state of low-grade inflammation, making you more susceptible to attacks. Finding simple ways to manage stress daily can make a huge difference. It doesn't have to be complicated. 5 minutes of quiet breathing, gentle stretching, or maybe trying something like Tai Chi, even just spending a little time in nature or making sure you connect with friends or family regularly, it all helps buffer that stress response.
Okay, this is all fantastic practical information. So for someone listening right now, maybe feeling a bit overwhelmed, what's the first step?
Great question. Let's create your action plan starting today. The key is, don't try to do everything at once. Choose one small, manageable thing to start with. Maybe today your goal is just drinking 1 extra glass of water, or adding a small handful of cherries to your lunch, or taking a 5-minute walk around the block after dinner. Just pick one thing, start there, build momentum. And please, remember the importance of building your support network. Don't try to manage this all by yourself. Talk to your family, help them understand what foods might trigger attacks for you. Ask a friend to be your walking buddy. Find healthcare providers who listen and work with you. Support makes a massive difference.
And what about medications? If someone is already on meds or thinks they might need them?
That's where the medication balance comes in. It's absolutely vital to work closely with your doctor or healthcare team. Have them review all your medications, prescriptions, over-the-counters, supplements to see if any could be raising your uric acid. Discuss these natural approaches. Can they complement your medical treatment? Sometimes lifestyle changes can reduce the need for medication or allow for lower doses. Make sure your kidney function is being monitored regularly, especially if you're on gout medication. And always look at treating underlying conditions like high blood pressure or diabetes holistically. It all works together.
It sounds like consistency is key.
Absolutely. Why this matters now is because every single positive change you make today, however small, adds up and impacts your health tomorrow. Gout management isn't about a quick fix. It's about consistent, gentle effort. It's about treating your whole person, mind and body, not just chasing the symptom of joint pain. And truly, your golden years deserve better. You've worked hard, you've earned the right to enjoy this time actively, without being sidelined by preventable pain. Don't let gout steal your joy, your adventures, your independence. You have the power to manage this.
That's a really strong, empowering way to wrap up the practical side. It's about taking back control step by step.
It really is. You genuinely have more power over gout than you likely realize. It's time to use it. And maybe here's a final thought to leave you with. We talked about gout being like a canary in the coal mine, right? A warning sign for inflammation affecting your whole system, your heart, your kidneys. So the bigger question is, if gout can be such a profound warning about our systemic health, what other little warning signs might our bodies be giving us right now? Things we might be dismissing as, oh, that's just normal aging. How could applying the same holistic view, looking at the whole picture, making consistent small changes, maybe transform other areas of our health and well-being too?
That is a powerful question to ponder. It broadens the whole perspective, doesn't it? Remember, folks, your health journey, taking back control, it always starts with just one single step. Make that step today.